I want to thank you guys for coming. First of all, this is something we have hoped to do for years, was to really say, can we start to kick off and do some evening seminar presentations? And so it's the first time we've been able to do this. And I'm going to introduce a dear friend of mine, and then I'm going to introduce the topic a little bit and maybe run a case by you, and then I'm going to pass the torch. So first I want to introduce Dr. Amy Baruch. Amy's been a dear friend of mine for about 20 years. So I got to meet, when I was an intern, just gotten hired to work for Emergency Medicine of Idaho at St. Luke's, which was about 1998-ish. And then I got to know her through the rest of my training, and then eventually I joined the ER group, and we worked professionally together for 12, maybe almost 15 years. Loved Amy because she's one of our most astute physicians in the hospital. She's incredibly bright. She was always that physician we loved to work with, because if we had a difficult case, she was the one we wanted to run it by. She's certainly one of the most compassionate docs I know. She's also one of those engaged people. She's involved in the community. She's always involved in hospital committees. She's a phenomenal musician. And one of these, which is really great, it's recently, well, let me back up. So if I remember right, her parents sent her to France when you were in medical school for like a 4 to 6 week cooking class at a culinary school. Oh, New York. Okay, that was France. France sounded better. So she's always been passionate about certainly medicine, nutrition, health. What Amy's finished in the last couple of years is she's finished a fellowship in integrative medicine, and she's going to explain what that really means. And I had talked her into, without having to twist her arm too hard, to come give us a talk on endocrinology and what science says and what evidence-based medicine says about nutrition. And so first of all, what is endocrinology? It's our endocrine system is multiple. We have all multiple glands. We have pituitary gland, we have our pancreas, we have adrenal glands, we have our sex glands. These endocrine glands really make signaling molecules. And signaling molecules are secreted by these glands that go around our bloodstream and affect the behavior of other organ systems. And they usually affect behavior either through genetically turning on protein synthesis, etc. The complexity in our endocrine system is what happens as we age and what happens as inflammation takes. And so really what we're going to hear about today is really our influence of sleep, our influence of nutrition, our influence of exercise, our influence of stress. And really particularly it's going to be today, I think probably one of the most important, is our impact of how we eat on our health and our aging of our endocrine system. So with that, I want to give one quick case. I always joke around that there's, probably stereotypically, there's two common scenarios I see. One is, and Dr. Wick, who's here as well, will attest to this. We see kind of the average 35-year-old often male that come in and say, hey doc, you know what? My shoulders bother me, my neck's bother me, my back's bothering me, doc, I'm falling apart. And it's that kind of that mid-age as we start having tendon issues. If we march forward 10 years, the other classic scenario I see is that same patient, male and women, coming in saying, hey doc, I'm exhausted. And I feel like my energy's terrible. I feel like my motivation's in the toilet. I come home from a busy day of work, and I don't want to take on any chores at home. I don't. If you ask them about mood, they're like, I do feel a little more depressed. I feel maybe a little more anxious. I feel more irritable. And as they march forward, you continue down the same road. Eventually, they start to get, start to affect libido and just overall vitality. And so much that is dependent on what we're going to talk about tonight in our endocrine system.
Excellent.
So with that, introducing Baruch.
Thank you for the invitation to speak and for your support as always. And I am so grateful to all of you. I really appreciate all of your time and attention. And I also want to send a thank you to Adam Sletti, who is my sous chef and my scribe at work. So I've spent the last 20 years running circles around the emergency departments at St. Luke's. And during that time, I've made some observations. I think we do pretty well at taking care of acute medical issues. The sepsis patient, the MI, the stroke patient, acute traumatic injuries. But that's really not the majority of our patients. The majority of our patients have multiple chronic medical conditions. And they are almost always paired with one or more, or actually several medications. Which means at the end of the day, they have a bag of medications, and that's actually what they come in with, is a bag of medications. We've all seen that. So intuitively, that doesn't feel like good medicine to me. And it's pretty obvious, I think, to most people that lifestyle is really the key issue. So around 15 years into practice, I thought I really need to do something different. I need more tools in my toolbox to help these patients. So the first thing I did, which I would encourage you to look at this website too, I went to thegreatcourses.com, and they've got an array of phenomenal courses on all different subjects. So I started with nutrition, and these are all by phenomenal professors all over the country. This is a gal, Roberta, handing out of Baylor. It's 45 lectures. It's a big time investment. And as I'm listening to these lectures, I'm wondering, I never learned this stuff in medical school. And I'm kind of wondering, why didn't I learn this in medical school? It's so important. So then I went on to do a stress in your body talk. This is by a guy out of Stanford, Robert Sapolsky, and this was also extraordinary. And then finally did a mind-body course by this guy, Jason Satterfield, who's out of UCSF, and their integrative medicine program. And at that point, I was completely hooked. So that's when I decided I was going to do a fellowship in integrative medicine at the University of Arizona, and that was founded by Andrew Well around 20 years ago. So now I think I got the tools to take care of my patients a lot better. It's really enhanced my practice significantly, and the big surprise was actually how it impacted me personally in such a significant way. So I would like to talk to you a little bit about what integrative medicine is, if I can get this to work. Okay. So integrative medicine is patient-centered, healing-oriented, addressing the whole person, mind, body, and spirit. And I'll take these in pieces. So integrative medicine addresses the whole person. And what I have found is that Western medicine has really reduced everything down to its individual systems. We take care of the heart and we take care of the GI system, but we forget the spiritual aspect too. That's so important in patient care. So integrative medicine attempts to address all of those issues in patient care. Patient-centered means that we address and respect a patient's preferences, their needs and values in the decision-making process. We don't call patients non-compliant. That's just not part of our vocabulary. It's very important to understand that person's situation, what's going on, and that may dictate why a patient is non-compliant. Healing-oriented. That means that healing can take place even if curing is not. We have a lot of patients that may have a terminal illness, such as cancer or end-stage congestive heart failure, but that does not mean that they can't heal. And you can be instrumental in that process as a clinician. The other issue, too, is just really appreciating how healing an encounter can be with a patient. And for me, before I approach a patient, I really do think about what's my intent when I'm going to go see a patient. My intent is to heal. 2, I try to really pay attention in the present moment and really listen to the patient. And then the last thing is really trying to show as much compassion as possible. And that in itself, that encapsulates, I think, can be extremely healing for a patient. Integrative medicine desires to identify the underlying cause of the illness. So we feel that it would be, it's obviously more beneficial if we can understand what the underlying cause of a disease is. If we can reverse that process versus suppressing symptoms would be better. I think a classic example would be like hypertension. If you could understand the underlying issues going on rather than just treating the blood pressure, treating the underlying cause. Another issue would be like acid reflux. We've got patients on PPIs. Right? That's a classic example. And usually if you look at lifestyle factors, you could probably address that pretty easily and avoid the PPI, which now we know has some major issues. And focuses on health, vitality, and longevity. That means that there's really a focus on optimal health. It's not enough just to not have a diagnosis or have a disease. Optimal health is something different. That's when people are thriving and at their best. And lastly, we delve into all aspects of lifestyle. And this includes evidence-based Western medicine and anything evidence-based and anything that's sort of non-traditional. So nutrition isn't non-traditional, it's just that we really don't do a very good job of it in our current setting. So nutrition is exercise and stress and sleep. Those are the real big ones. But also things like botanicals and supplements if they're evidence-based. spirituality, mind-body techniques, environment, community, and relationships, all of those things are taken into account when we're taking care of a patient. So, this one I have to tap a couple times. I did not set it up this way, but for some reason it did this. So today we're going to talk about hormone balancing. And it's not really a talk about whether you should be on testosterone or estrogen. It's not about, does adrenal fatigue actually exist? I don't know the answer to that question. Or, doc, my thyroid is kind of borderline. Do you think I should be on thyroid medication? This is really about the why. This is trying to understand why somebody might have a hormone imbalance to begin with. And I'm hoping to answer those questions, or at least begin to answer those questions here this evening. I have a couple of disclosures. And the first is that although I'm here teaching, I am still a student of integrative medicine, and I will probably be a student of integrative medicine for a long time, probably the remainder of my career. And then the other one is that I think that we're all works in progress. I'm a work in progress, we all are. And so if you come across something as we're going through this that really speaks to you, or something that you perceive to be an issue, the first thing I want you to do is not feel badly about it, and show yourself self-compassion. So this is all about being armed and being empowered with more education to improve your health. So this one says, I'd have the man boobs off if I could just stop playing with them. So Rob mentioned that there are several symptoms that somebody may come in with hormone imbalance. And I want to preface this by saying that it's really important to understand that today we're looking through the lens of hormone imbalance, but any one of these symptoms could be from another cause. And it's also looking at the constellation of symptoms that you're seeing here. So I just want you to keep an open mind. If you see those symptoms, it doesn't necessarily mean it's definitely related to a hormone imbalance. The most common ones, which Rob mentioned, are things like fatigue, mood disorders, and weight gain, low libido. I think those are going to top the list, but also things like sleep problems and other issues for men, as seen in the cartoon, man boobs and erectile dysfunction, and for women often have a lot of female issues, such as regular menses and PMS, hair and skin changes, and even just digestive issues, and just even advanced aging. People will age quicker if they have a hormone imbalance. So the outline for our discussion, so we'll talk about the endocrine system, and I'll review that with a picture, but it basically is reviewing what Rob just said. But factors impacting hormone imbalance, we'll talk about age and genetics, hormone disruptors, which is fascinating, insulin resistance, and overweight, obesity, stress, inactivity, poor sleep. We'll grab something to eat. Hopefully this won't take longer than another 50 minutes. We'll get some food, sit down, and then we'll talk about nutrition. So the endocrine system, so it is a whole group of glands and organs that produce hormones. And hormones are basically chemical messengers. They're made in that gland or organ. They're sometimes stored there, and then they're sent out to their target organs. The common ones that most people know are obviously the testicles and the ovaries that produce our sex hormones. And obviously they have several roles. The most common are going to be related to reproduction, libido, as well as behavior. Obviously there are many more. The adrenal glands that produce our stress hormones, so adrenaline, cortisol, and aldosterone. Pancreas, and this is really, as you'll see, is really the mother hormone that produces our insulin, which controls our blood sugar, thyroid, which produces thyroid hormone, which controls our metabolism. And I'm going to mention the hypothalamus and pituitary because there are feedback loops from the hypothalamus and pituitary in the brain to the adrenal glands, the pancreas, and our sex hormones. And then lastly, I'm going to mention adipose tissue. Adipose tissue was once thought to only be where we stored fat. And now we know that it's actually a very active endocrine organ, and it's probably probably the biggest endocrine organ. And I'll have a slide specifically looking at that as well. And then the liver and gut are turning out to be very important as well for the elimination or just the metabolism of our hormones as well. Now we tend to look at hormones one at a time. Somebody has a thyroid problem and we take care of their thyroid. But that really is an oversimplification of the endocrine system. And this is just a slide just to illustrate that when you disturb a hormone, it's going to actually in turn disrupt the other hormones as well. And that's all. For the purpose of education and understanding things, I think that's why we simplify it, because it's just too complicated and confusing.
I'll ditto, I think, in endocrine. It's difficult to sit down with patients and try to explain the impact of one thing on multiple things. And even when you start looking at these slides, these are really simplistic slides. The other thing is we even talked about even tonight, put some notebooks on everybody, so feel free to take notes. If anybody, I'm going to email anybody a full copy of this presentation, so if anybody leaves me their email address, we'll send it to you. And then we also want to encourage dialogue, so if you guys have questions, we can throw it out there.
Absolutely. So, age. So, as we age, our hormones change. And in the case of estrogen, progesterone, which we're not going to talk about a lot, but it's very important for balancing hormones for women, testosterone and growth hormone, those gradually go down as we age. So for men, testosterone probably peaks at around age 25 and then goes down by 1 or 2% a year after that in a steady decline. People are already starting to figure out the math in their heads. Estrogen for women, so the perimenopausal period really can occur at any time for women, but most commonly may start in the 40s, early 40s into the early 50s. But the perimenopausal period is usually around 10 years, not the 1 or 2 years that we've been told. So that is a little bit of a more sharp decline. And then the two that go up as we age, I find this interesting, are insulin and cortisol. So we've heard of insulin resistance, which we're going to talk about at great length. But that's what happens. As we age, we become insulin resistant, unrelated to anything else but age. And then cortisol gradually goes up as well because our bodies are less able to buffer stress as we get older. So that's just one factor that we don't have a lot of control over. The next one is genes. Now, I think that this is so interesting. So I think for a long time we thought that we were our genes. So if our parents had diabetes, that we were just destined to get diabetes, or if our mothers had breast cancer, that we would get breast cancer. And obviously there's some situations where somebody's at high risk. But epigenetics is now telling us that we have more control over our genes than we once thought. So it's basically the study about how our environment, everything from the food we eat to things like exercise and stress, our environmental exposures, how those things may either turn on or turn off genes. And so I've got just two illustrations which I think are interesting. So this was one study by this gal Blackburn, and she looked at stress and cellular aging by looking at telomeres. And even though these words may sound foreign to you now, I think it's really important just to even get them out there, because there are things you're going to read about more and more in the next several years. So telomeres are the caps that sit at the end of your DNA. They're actually DNA sequences, and they're very important for replication of that cell. So the shorter the telomere, the older the cell. What they found in that study is that women that self-reported high levels of stress had shorter telomeres compared to the women who reported less significant stress, on the order of 10 years. So when they compared their biological age with their cellular age, there was a difference of 10 years. So the other case I had here was FTO gene, which is an obesity gene. This is found in abundance in the Amish, and yet they do not have a significant incidence of obesity. And in the study, they looked at exercise ended up being the primary factor that trumped the obesity genes. So they clocked around 18,000 steps a day on average. So there we go, that exercise has the ability to impact genes, and stress has the capacity to impact genes as well. I just think it's really empowering to realize that we have a lot more control than we once thought.
So we know, even when I was a resident, like in pregnancy, so there's this whole, we have genetics, and we have our phenotypic and our genotypic. So we turn on and off genes. We've got hundreds of thousands of genes. So we can, then on your environment, you can, and so for women that were pregnant and had gestational diabetes, their offspring have a significant increased risk of diabetes long term. In the fold of even 20-fold increased risks in some studies. So again, just that intrauterine environment, maybe being hyperglycemic has the ability to turn on and off genes. And so there's a lot of people starting to worry about, like when you look at the Western trends of where we are we turning on and off obesity genes? Are we in a short period of time, are we changing our culture? We always thought, hey, it's going to happen over thousands of years, but is that really necessarily true? Does it happen in a much shorter period of time? So it's a fascinating field.
Yeah, epigenetics looks not just at how it impacts you, but how it impacts your progeny as well. So something to look out for. And there's subcategories of epigenetics like nutrigenomics and pharmacogenomics, looking at how drugs may impact different people in a different way. So something, yeah, just keep an eye out for that. So we talked about age and genetics, now we're talking about hormone disruptors. And this was an eye-opener for me. I knew nothing about this before I started my fellowship. So hormone disruptors are basically things in our environment. They could be foods, they could be chemicals, that basically mimic hormones, or they look like the hormone that's naturally in our body, but they're not that hormone. So they can mimic, they can block our own hormones, they can actually convert one hormone into another hormone. We're going to talk about the dirty dozen, and we'll just pick a few out of that list, but this is out of the Environmental Working Group, which I really encourage people to look at. It's ewg.org, and has a lot of information about environmental issues and specifically about hormone disruptors. So hot off the press, before I forget, I wanted to, this I found interesting. So this just came out October 30th of this year, and this is the title of this research study: Association between pesticide residue intake from consumption of fruits and vegetables and pregnancy outcomes amongst women undergoing infertility treatment with assisted reproductive technology. And this is the bottom line. So women who, compared to women in the lowest quartile, those women who had high pesticide intake had an 18% lower probability of clinical pregnancy and 26% lower probability of live birth. Wow, that's fascinating. So we'll talk about that in the next slide. So what are the common ones? This is just the top 12, but there's a lot more. So plastics, I think a lot of people know that plastics are an issue, but I think it's important to know a little bit more than just plastics. So the specific ones that we need to look out for are the ones that have the recycle 3, 6, and 7. So 3 are the flexible plastics, that's the phthalates, and those are also in cosmetics, something to be aware of. 6 is polystyrene, basically your styrofoam cups, styrofoam that your food comes in and you don't have time to cook, all those things. 7 is your hard plastics, and that's your PBA. So that's going to be in plastics, but the other place, there's 2 other places that are really concerning. One is PBA lines a lot of canned goods. So you'll see now certain cans will say PBA free, and the rest of them probably are lined with PBA, and that's so that the food doesn't take on the taste of the metal. So I would encourage you to look for that when you're buying any canned goods. And then the other one are receipts. So I say no to receipts now, because that kind of waxy coating on there, that's PBA. So I just don't even, I don't take receipts anymore unless I have an issue. So very important with plastics is just to avoid microwaving any plastics, any food plastic whatsoever, because it does leach into the food. And then if you can avoid storing your food after you've cooked it in the, you can store food in the refrigerator. If you can store it in glass, it's better. And I'm not perfect. I eat out of plastic things when I have to get a last minute, dinner at Trader Joe's or something like that. Of course, I do that, but I really do avoid putting it in the microwave and have a set of glassware that I use now for storage. Dioxins, it's not so important that we know the names of them, just know where they're coming from, are just basically industrial runoff. So this makes its way into mostly animal products. So milk, meat, eggs, and fish as well. I'm going to talk about herbicides and pesticides. I think these are a big category, organophosphates as well as atrazine. And we'll talk in the next slide about which fruits and vegetables we should eat organic and which ones you could probably get away with not eating organic. But also how it pertains to our drinking water. So there's several areas where that's an issue. So with herbicides as well as any of the heavy metals such as lead, arsenic, and mercury, I think drinking filtered water is going to be much preferred just to avoid these as well. This is just to highlight that there's a lot of endocrine disruptors that are actually in our environment. So in this particular case, this is with reference to these polybrominated compounds that are largely been phased out, but they're still in our homes because they are used like in rubber padding for carpets or foam in your furniture and fire retardants that were used inside of various electronics. So a lot of people, even though they've been phased out, people have a lot of these products still in their home. I'll mention in the next slide how to avoid them, but basically they accumulate in house dusts. So just emphasizing the importance of vacuuming and using HEPA filter. This is, I'm sorry you can't see the bottom here, but this is our PFOAs. These are in your nonstick pans. So I would encourage people to not use nonstick, and if they want a nonstick equivalent, to use a ceramic-based pan. Lipoethers, this is just a general category. I just encourage people to look at the products they use in their home, their cleaning products, etc., as well as cosmetics that you use. And the next slide will have hopefully a summary of how to avoid hormone disruptors. So eating organic when it comes to meat and dairy and eggs, I encourage that as a strict rule if you can afford it. And limit consumption of larger animals and fish due to bioaccumulation. So with fish, avoid predator fish because obviously, right, they are around a lot longer. They have more time to be exposed to various toxins, and they're eating all the smaller fish as well. So due to bioaccumulation, I would avoid the big predator fish, as well as animals like, that are obviously they're around a lot longer for the purposes of, accumulating toxins. And as we'll talk in nutrition piece, to limit consumption of animal products in favor of plant products, if possible. That will also help limit your exposures. Drink filtered water exclusively, and I would avoid even drinking out of plastic if possible as well. Start looking at the products that you use as cosmetics or just household, and I'll show you an app that you can get on your phone that's helpful with that as well. Avoid the plastics 3, 6, and 7. Heat, plastic, don't mix. And vacuum your home frequently if you can with a HEPA filter and avoiding non-stick pans such as Teflon. Okay. So this is out of the EWG website, the Environmental Working Group. This is the Dirty Dozen and the Clean 15. So these are the ones that you're going to try to avoid buying as non-organic, and these are the ones that you probably can get away with buying just regular conventional produce. It's hard to remember them. I would say what the Dirty Dozen have in common is the fact that it has a peel or has a porous exterior that you consume. I'd say that's the easiest way to remember it. These all have skin or something that you're peeling away so that you're significantly reducing the amount of potential pesticide exposure. And this is the website. This is also put out by the EWG. It's called the Healthy Living app. You just download it. It's free. And this is a combination of two apps that they used to have, Skin Deep, which was for cosmetic, and Food Scores, which were for, for food shopping. So they have around 120,000 items, which isn't enough, but it's a good start. And you can actually just go use your barcode on the food, and you can find out lots of information about that particular product. Another option is you can just put in a generic, like, particular item you're looking for, and then it will give you the various things that are under that category, so at least you can make a better choice as to what you purchase. So in this case, Dunkin' Donuts, their non-dairy flavored liquid got a really bad rating. So 1 is good, 10 is the worst. And then they give you sort of a generic summary of why they think it's bad. So,
That's your favorite one to eat.
you just
I've just been robbed of everything.
I
think we're the only cops in here.
You just advanced it a little bit.
Actually, surprised I don't have that in the fridge.
Imagine this.
It's okay.
Check that. Try this. They use Dunkin' Donuts now. There we go.
Good, great.
It hurts.
So anyway, I have this on my phone. I think it's worth trying. Just like it said here, you can scan or then browse based on a particular product. So in this particular case, food additives are concerned. Hormones may have been used in the production of these dairy ingredients. There's some concern about trans fats, which we'll talk about. They talk about sugar content. So 1 serving is 2 teaspoons of sugar, which is probably the average amount of sugar somebody puts in their coffee, but usually people pour a couple of servings, right? And anyway, so I find this helpful.